All right, Jay. Here we go.
I'm ready.
You ready? Nice. All right. Good morning. It's Friday. We got a lot of information this morning. Thank you all for joining this morning. Thanks to Jay and Vicki, as always, for helping interpret. We do have the health commissioner here, Greg Kesterman, but as always, I'm going to start with the numbers and let him elaborate. So as of this morning, we have 1,927 positive cases of COVID-19 in Hamilton County, 355 hospitalizations, and 105 deaths. That's for all of Hamilton County. The differences, the deltas, for those who have tested positive since last time we were together, which was Monday, is 70. Those that are hospitalized is 22, and the deaths between now and Monday is 4. Okay, so some more perspective on the numbers. So I'm a very visual person, and so I have asked my chief of staff to chart this from beginning to now so that we can better understand the trends, because what we need to understand, and you're going to hear the health commissioner talk about this, is the trend line. Are we trending up? Are we trending down? Have we plateaued? What numbers are meaningful? And so we have got a graph up on the screen. I love that graph because it helps us kind of work through what we think we know. So we have this chart which shows new daily cases on a 5-day rolling average. It's worth mentioning that the cases number is volatile because we're ramping up testing. So let me finish my comment. So we will obviously get more positives. So it is not an apples to apples comparison versus previous numbers. Hospitalization numbers and deaths are actually better for watching trends. So what that means is that the positive cases is going to go up as we see more testing. So that is it's difficult to understand, I think, those numbers. The hospitalization rate, though, and the death rate, you can see very clearly that we had we were on the way up, and we talked about this. We plateaued a little bit, and now we are slowly on our way down. I think what we all have to hope is that this continues, that we don't see an upward trend as we start to reopen things. So that's the goal, right? We've done our work. You all have done the work. You have safely distanced. You have washed your hands. You're wearing masks. You have created these trend lines. And that was the goal all along, from the state down to the county, down to the city. This is all what we've been trying to achieve. And so we have achieved that. Again, the fear is that as we start to see a change in these openings, that behaviors change to a point where we no longer see that trend. So I have a little bit of trepidation today. I think the health commissioner does too. But we are hopeful that people will do their part to make this continue to play out. So we are seeing a steady decline in hospitalizations over the last 2 weeks, which is encouraging. So this morning we've got Greg Kesterman. He's going to talk more about the trends in reopening with a special emphasis on restaurants, because that is, I think, kind of the news of the day. But I have a few announcements before we get to you, Greg. So today is Peace Officers Memorial Day, a chance to recognize and thank the men and women who serve us during these trying times, especially now. I'd also like to take this time and opportunity to remember Springdale Officer Grant, who died in the line of duty earlier this year. Our thoughts and prayers are still with her family and for all the good people at the Springdale Police Department. I did visit the police department when Officer Grant passed away, and they were profoundly affected by her loss. And so this day gives us an opportunity to remember that there are people in this community that are on the front lines, putting their lives on the line every day for all the rest of us. And we are profoundly grateful for their work and for their service. So for today, the governor has ordered that all U.S. and Ohio flags be flown at half-staff on all public buildings and grounds throughout the state from sunrise to sunset. We are doing that, obviously, here in Hamilton County, and our flags are flying at half-staff. So as we do this, please join me in recognizing and thanking the men and women of law enforcement in our community. I want to give some additional information related to the CARES Act funding. We talked last time about the 4 different pots of money for the CARES Act funding. Remember, this is the restricted fund. The money is coming from the federal government. We are very grateful for these dollars and for the advocacy of our federal delegation to allow for some flexibility here in these dollars. And so remember, there are 4 different pots. One is related to the county safety services. So a lot of that is related to the sheriff's office, some sheriff's patrols, some of those things. Internal operations as we redeploy people, sanitizing the building, those kinds of things. One of the pots is related to public health. As we have seen, we need to ramp up public health so that we are prepared, working now and into the future for this kind of situation. And so that is related to PPE, that is related to the work of public health, it is related to testing, so that's another pot of money. Another one is related to vulnerable populations. Think about the homeless, think about folks with disabilities. And then the 4th pot is the one that talks about economic development. So it's rental assistance, it's nonprofit assistance, and it's small business assistance. So the top of the pile is the small business assistance. So you've heard me talk about this. We are launching this next week. We will get to rental assistance and nonprofit assistance fairly quickly thereafter, but we have been really trying to focus. And remember that we have never done this before, right? This is a new revenue source for us. And so we are trying to balance getting the money out the door as quickly as we can because we know there's a need in the community, and creating a program that is fair and balanced, and we have to prove that it's related to COVID-19. Because if we don't do that correctly, that money won't qualify, and we're going to have to pay that back. And that is the last thing we want to do. And so we have been relying on our staff and our partners throughout the county to help us put something in place that is meaningful for small businesses, also fairly distributed to small businesses. And I must say that Holly Chrisman, the Assistant County Administrator, has been working on this day and night, trying to get this thing launched, and I cannot thank her enough for her work on this program. The other partners, and there are many, but some of the partners that she's been dealing with and talking to include the Regional Chamber, include the African American Chamber, the folks over at Mortar, the folks at the Urban League, Planning and Development, HCDC, so you can see that these are people that are on the ground and experts trying to help us inform how we roll out this program. So there have been some changes. So, and I don't want to highlight the changes. So first of all, 335 businesses have gotten onto the county website and are in the queue for information. So the way to do that is to go to HamiltonCountyOhio.com to get information from the county relating to the documents that you need, the eligibility requirements, and when the application's going to go live. We expect that, by the way, to happen next week. So if you want to get in the queue for that information, please go to HamiltonCountyOhio.com, and we'll make sure you get that information. All right, so a couple of changes, and these changes are informed by the conversations with the partners I just talked about. All right. So we're still finalizing the program. We're very, very close. Expected to launch next week. Of note, this is now a grant program. Remember, it was a forgivable loan program. We thought a grant program would frankly be easier for small businesses to use, and so that's what we're doing. And thank you, by the way, to the small businesses who have reached out to me personally and kind of talked through your suggestions. All right, so here are some of the parameters. The businesses must be for profit. Remember, we've got a nonprofit bucket coming. This is not that bucket. This is the for-profit small business bucket that has been in operation since January of 2019. So you have to have been in operation since then. Less than $1 million in gross revenue. Small businesses need to consist of 2 to 50 employees. I'm going to stop there because we have decided, remember the target is for small businesses that are really struggling, that haven't gotten federal assistance. And so we have now split the money in 2 different pots. The one pot is going to be for businesses from 2 to 10 employees. The second pot is going to be for the businesses with 11 to 50 employees. So small to relatively small businesses, knowing that we really don't know how many businesses are going to take advantage of this opportunity. So we're trying to figure that out in the meantime. So the businesses have to have experienced a decrease in gross revenue receipts of 35% from COVID-19. That was 50, it's down to 35 now. But it has to be related to COVID-19 response and the reduction in revenue related to the epidemic, or pandemic, I should say. The businesses must be located in Hamilton County, Ohio. They must not have received the PPE or PPP assistance from the federal government, and they must have a physical storefront. I do want to say that I've heard from some businesses that got some federal relief, and but this is a $10,000 grant. I understand that concern. That's not where we are right now. We're really trying to provide relief to those who haven't gotten anything so far. But remember, we are poised after this goes to take a look at what we've learned and potentially put more dollars towards this effort. So hang in there. It's coming. We just need to get through this first tranche. Eligible expenses include, all right, so this is what you can use the money for: mortgage and rent payments for the business's principal place of business in Hamilton County, utility payments, salaries or wages of employees, materials and supplies, inventory, and PPE or other COVID-related costs. All right, I think that's pretty clear. All right, so applicants will fill out a pre-application or pre-screen to determine if they meet all of the requirements and certify that the information submitted is true and accurate. That's the first step. We are going to do a lottery drawing. This has changed as well. We heard from a number of businesses and organizations that it would be most fair to have a random draw or a lottery for this. We had talked about first come, first serve. There are inherent disadvantages that happen when you do it that way. That is played out in other places. We're trying to make this as fair and open as possible, and so we have shifted to a lottery. So because of that, the application period will open and then it will close. And we will then have those businesses, we're going to sort them 2 to 10, 11 to 50, and see how many we get in each pot. That will determine the amount of money going to either very small or small to medium-sized businesses. So we're going to figure that out, and then we're going to do a lottery. And then as businesses get picked in the lottery, then we go back and do a vetting to make sure they qualify, have the documents available. If they don't, then we simply go to the next business that's in line through the lottery. We're thinking that's the most fair and even-handed way to do this. So then we get into the documents obviously will need to be submitted to do some verifying about eligibility. The awarded businesses will be required to sign a grant agreement prior to the release of funds. HCDC, the county arm of economic development, will then transfer the grants to the businesses. We do hope that this will move as quickly as possible to provide the relief as quickly as possible. Businesses are required to submit a final grant report to include, at minimum, jobs retained and created, proof of payment for expenses identified in the business's application. And again, because of the federal regulations, all of this has to be related to COVID-19. All right, so that's enough about that. Pretty excited about this, actually. it's, I think, a great opportunity to help small businesses. And so we're doing our best work. Again, hamiltoncountyohio.gov. All right, one more thing before we get to Greg. So this week, I had the chance to participate in a unique online series held at the Cincinnati Fire Museum. The museum is hosting, now remember the museum's closed, but they are hosting presentations and storytime readings by Cincinnati firefighters and other members of our community. So they're doing it online, so it's presented on Facebook Live. Families can RSVP to the event by visiting www.facebook.com/Cincy Fire Museum/events. Thank you. So go to the Cincinnati Fire Museum website. You'll find it. I jumped on there myself to see some of the story time. It's fun. Some of the firefighters are doing walkarounds in the museum, like virtual museum tours. It's really cool. If you've got young kids especially, it's geared towards them, so I would encourage you to jump on it. It's really a fun outlet. All right, Greg. So there's a lot going on. As you know, we in Hamilton County have been very careful and very thoughtful, I think, to your credit, Greg, to following the lead of the state, of the governor and Dr. Acton, and trying to do our best work for Hamilton County residents to help folks understand what's happening and then interpret, in some cases, what's happening and what is best for the folks in this community. So Greg Kesterman, the interim commissioner of public health in Hamilton County, has been on the front lines, taking the lead, and so we are so grateful that he's back today. I suspect we'll get some questions related to some of these openings, and Greg today has a slideshow to help illuminate some of what we're doing here in Hamilton County. So thank you so much for being here, Greg.
Thank you, Commissioner. So I want to touch base just briefly on the graphic that Commissioner Dreihaus just shared. My team will be watching those deaths and hospitalizations very closely as we are moving forward in the coming weeks. We have done a great job in Hamilton County, and for that matter, the state of Ohio, in flattening the curve and allowing time for our hospital systems to create the necessary capacity to do what they need to do. I have a slide showing what the 5 requirements are as we reopen Ohio. And I think it's really important as we move down this path of reopening Ohio that, that businesses are appropriately masking themselves, as well as customers, while they're not required to mask. It's strongly encouraged, and I think it's the right thing to do. So if you're shopping at the grocery this weekend, please wear that mask. If you're going to go out to eat, obviously, while you're eating, you can't wear a mask, but while you're coming into the restaurant and you're close to the host or hostess that's going to sit you in the outside eating area, please be respectful of them as well. The other items continue to just really emphasize from a business perspective that we need to do some employee checks. This will pertain to restaurants as they're opening up. This has been a requirement throughout this pandemic for employees, or employers, I should say. Obviously, we need to continue to practice hand hygiene and general hygiene as we work through this. So restaurant workers and other employees need to make sure they're washing hands frequently, sanitizing, and doing those things. That actually now obviously applies to each of us as we're going out more in public. We have a greater responsibility to continue to do those things. Businesses, obviously, including restaurants, now have a greater responsibility for sanitizing and making sure that surfaces are clean and are cleaned in between customers, particularly in the restaurant setting. And then lastly, obviously, as we're opening things back up, we are limiting capacity so that we have more ability to social distance. So let's talk a moment now about complaints. As more folks are going out this weekend and doing things as businesses are open and eating out, if you see something that makes you feel uncomfortable, I would really encourage us each as citizens and individuals to step out of that situation. If you have to run an errand and you're not pleased because not all of the workers are wearing masks, you don't have to stay. You can leave. Let the business know that that's why you chose to not shop at their business. Make sure they know that that's a new norm, and we expect that as Ohio is opening back up. In addition to that, you're certainly welcome to file a complaint with our office, hcph.org. We will take each complaint and inspect. Our process is phone call to the store first. Secondly, if we continue to get complaints, we will go to the store and do an inspection, and then if necessary, we'll issue a notice of violation. No differently than when the order first went into place, we are working very closely with our jurisdictions. Hamilton County Public Health serves 45 cities, villages, and townships. We will work with each of those to help us with the enforcement process as we move forward. So I'd like to touch base. Obviously, Governor DeWine and Dr. Acton listed a whole bunch of new businesses that are getting ready to open. The first being, as we know, restaurants in the outdoor environment are able to open today. There are new requirements requiring 6 feet of distance between employees and guests. So seating will look different in these environments. Masks are required for employees, and hand sanitizing I've already shared, health checks, no self-service. So if you're used to going to a salad bar, that is no longer permitted at this time. And restaurants are supposed to have a plan available that our team will continue to look at when we're out doing those complaint inspections. We know now that Ohio has allowed childcare to begin opening on May 31st. This will also look different. As we head into summer months, kids get to do field trips. That sounds like that's not going to happen in the same way. We are also reducing classroom sizes and requiring daily temperatures. And the guidance, the complete guidance, is on the coronavirus.ohio.gov website. I also want to share that the state did announce yesterday that they will be making $60 million from the federal CARES Act money available to help child care deal with these new reduced classroom sizes. So as that information becomes available, we'll put more on the site so that our local child cares have access to that money. The governor yesterday also announced a significant number of other businesses that are allowed to get back open. Once again, this is going to be in a new way. We know on May 21st, campgrounds will be allowed to open. We know on May 22nd, we'll start to see horse racing again, although there won't be any spectators at that time. We know that gyms, fitness, dance, including tennis, sports leagues, non-contact, and swimming pools are all going to be allowed to open as well on May 26th. And then lastly, they did give day camp as well on May 31st. There still are businesses and lots of activities that are not allowed yet in Ohio. The governor and director of health are continuing to work with focus groups to get those businesses open in a safe way that will have the least ability to impact those activities. So I'll show another slide just to re-emphasize as we open Ohio again. There are different ways to slow the spread of the infection. Obviously, I've talked a lot about wearing masks. If I cough and I have a mask on, that prevents the spray from my mouth from getting on surfaces. So it's a break in the spread of the infection. In addition, if I wash my hands often, I'm also stopping the spread of the infection. The hard touch surfaces also need to be sanitized very often at the businesses as well as the customers and other individuals need to wash their hands. So there, as you can see from this graphic, there are several ways we can slow the spread of the infection, and we've done a great job of getting that message out, and now it's really up to each of us to do these steps to help prevent as many new cases as possible. So once again, as we're starting to open things back up, we all have a personal responsibility. I already shared that if you go to a business and they're not doing things correctly, we have a personal responsibility to leave that situation. As we get new cases because of this increased testing, we're going to see my team continue to get busy with contact tracing. I have a graphic here just to kind of emphasize what contact tracing looks like with regards to the volume. So on average, over the last 30 days, we have seen 21.3 new cases per day of positive individuals with COVID-19. With each person that has COVID-19, we know that 20 people on average will need to be phone called and self-quarantined as a result of that exposure to the individual. Oftentimes, throughout the contact trace or throughout the quarantine period, we see additional people get sick. So if we have one more person get sick, that means 20 additional people are now quarantined as a result of that. Similarly, if the next group has a couple more people get sick, we've now exploded the number of people that are being contacted by public health. This is where we're kind of continuing to build that army of contact tracers and making sure that we have the necessary team to manage this workload. I've continued to share that the county has been very generous in helping public health by supplying individuals to help us with this work, and we continue to work with other volunteer organizations as well, just to make sure we're where we need to be as we continue to see cases ramp up. So in closing, I just want to say, as we work through Responsible Restart Ohio, it's up to each of us to do what we can to make this happen. I hope people are able to safely enjoy some of the new activities that we're getting back, and we look forward to keeping the curve flat as we get things open. Thank you.
All right, thank you, Greg. Responsible Restart Ohio. I mean, I do think that says it all. So as we start to re-engage, things reopen, we do need to do it in a responsible way. I'm going to ask you guys to put up that graph again, the blue, orange, and red, because I think it needs to be a constant reminder of, well, I love that one too. The contact tracing one is really gives you the idea of how things explode pretty quickly. But this graph, I think, is a constant reminder not only of where we are at this moment in time, but what we've achieved collectively in this community to keep these numbers down. I mean, it's just a really impressive visual. I've been asked by staff to repeat the website for the small business. I may have misstated it. I apologize if I did. HamiltonCountyOhio.gov. Thumbs up on that. HamiltonCountyOhio.gov. I don't know what I said before, but I apologize if I confuse people. All right, so Bridget, we are open for questions.
Yeah, our first question comes from Chris Wederick with the Business Courier for you, Commissioner.
Hey, Chris.
Hey, good morning, Denise. First question about the small business program. So do you think applications are going to be available next week? Is that the timetable as far as you know?
Yes. We are very hopeful that the application will go live probably mid next week. You can see this tug and pull, trying to get it right, but we need to get the money out the door. And so the goal is Wednesday of next week, and we're hoping to hit that goal.
Everybody who signed up with that form on the website, they'll get the notification when it's available.
That's right. That's the
Okay,
beauty
great.
of getting in the queue. You're going to get the information when it becomes available.
And can you talk a little bit more about converting it to a random draw situation? That was input you said that you got from the Chambers of Commerce. Is that correct? And other small businesses?
There were a number of folks that helped inform that decision. And so I think what we learned, or what we heard from the federal program with the PPP, was that folks, it was first come, first serve, and some people were businesses were disadvantaged by that model. I think it gets to this idea that a really small business oftentimes doesn't have an accountant on staff, doesn't have the ability, or a grant writer, or someone that's used to doing this kind of thing and interfacing with government. And so it's a little bit more challenging for them first to understand which documents they need to have ready and available. Also, to get that documentation together can be time-consuming and challenging. And so we didn't want a very small business to be disadvantaged by not being able to get that information to us quickly. And so then you advantage other businesses right away. That's not the point of the program. In fact, the point of the program is to provide assistance to those that need it the most. And oftentimes, those are the very small businesses and that are kind of not, I don't want to say on a shoestring, I don't think that's fair, but do not have some of the resources that the larger businesses do. And so that's why we've converted it to a lottery draw that was, and we're also, beyond asking folks in Hamilton County what they think, and these are the African American Chamber, the regional chamber, but also looking at programs throughout the state, because other counties in Ohio have also received these dollars with the same restrictions. And so we're looking at them too to see what they're thinking. Some of them have launched, many of them have not, because they're thinking through the same things that we are. But we're having conversations with them, learning from one another about what they are seeing and what they're thinking. And then we're looking nationally at what's going on with other programs throughout the nation. So it's a work in progress. And in some ways that can be a little frustrating because there's a little bit of a delay built in there. But I really do think that we are taking a really thoughtful approach to this, knowing that we need to get something hopefully live by next week.
And then one last question on this issue, and I know I'm going to get asked this. How do you think how is the draw going to actually be conducted? Is a computer going to do it, or are you going to have names in a hat? Any idea at this point on that?
So HCDC and Planning and Development and the administration are going to work through this. I don't know if it's, Bridget, do we know this?
Yeah, it's randomization software, so it won't be done by a person. It'll be done by computer.
All right, so it's going to be done by a computer. No wonder I don't know, right? This is not my forte. But I do trust that the people that are overseeing this program, we have gone to great lengths to be as fair as possible. And so a randomized, computerized draw is how we're going to do it. Thank you for that information.
Thanks, Denise. And then one question on the chart you showed at the top of this briefing with the hospitalizations and the deaths and the cases. Do you guys have the same lag on the hospitalization data that we see at the state, where they are not sure? I mean, it's not that they're not sure, but they're going to update those hospitalization numbers for basically the 14 days after they first post them. Is that the case with your numbers too, or
speak to that?
Thank you.
For the most part, hospitalizations here would get updated daily and be accurate with the daily 2 o'clock update on our website. I will say there are instances where somebody is home and starts their quarantine at home and becomes hospitalized. Sometimes there might be a day or two lag, as we have a difficult time then reaching that individual if they don't notify us ahead of time. But almost always it's a daily update.
Thank you. That's all the questions I had.
Thanks. Our next question is from Jay Hanselman for you, Greg.
Good morning.
Good morning, Greg. Just a couple of quick things. You talked about it again this morning, the requirement for face coverings for employees. The last week, I can't tell you how many businesses I've been in where I've seen employees with the face coverings. They're covering their mouth, but not their nose. Isn't that kind of defeating the purpose?
Yes, it's really important that when you wear a face covering, it covers your entire nose and your mouth. I've heard people complain that sometimes it's hard to breathe and it does restrict airflow. If an employee is away by themselves, they certainly could, in their own space, take off their mask and take a break from it. But generally speaking, the only way a mask is effective is if you're wearing that mask correctly.
And yesterday during the commission meeting, you provided an update that you were surprised that you actually had very few complaint calls, and you were concerned that may pick up as more and more things reopen. Remind me again how many people you have to handle these complaints, and are you satisfied that it's enough to deal with them as more and more businesses reopen?
So I have my environmental health team is managing the business reopening process. I believe there are 12 individuals right now that are in the division that are helping man this program. As things open back up, if I'm not using those staff for calling businesses and managing those complaint inspections, obviously they have other work to do. If we see them get overwhelmed, then I have other avenues, other team members from public health that could come in, as well as I could reach out to the county commissioners and see if there's another opportunity for collaboration.
And I'm not sure, this question may be for you. It also may be for Commissioner Dreihaus. The city had launched this program for outdoor dining for the parts of the county that aren't in the city. If places wanted to do that, is that a decision that is more left to local jurisdictions like cities and villages and townships to set up that process?
I would, I'll defer part of the answer to Commissioner Dreihaus. From a public health perspective, obviously my team regulates restaurants. Eating outside is not a very hard thing to accomplish. Where we start to get more complicated and requires a significant amount of planning is if a restaurant wants to move a grill or some portion of the cooking outside as part of the experience. In those scenarios, they absolutely have to contact the health department to make sure they do it correctly. Commissioner, do you want to talk about the jurisdictions or?
Yeah, so we, as you know, and I think I've mentioned this before, we are on a call twice a week with all of the jurisdictions in Hamilton County, so all 49. And so as the city started to do things like close streets, we were on calls and said, you know, is anybody concerned about this, thinking about this, need any information here? And so far, we have not received any requests for help or any clarity related to that. Anecdotally, and Bridget, can we pull up the picture from my friend at Price Hill Chili? So anecdotally, I've talked to a number of restaurateurs. This is Price Hill Chili. I think as of this morning. I called Steve Beltos, who I've been in touch with regularly, as you know, and this is how they are doing outdoor dining. And this is their parking lot. And so you can see that and I don't know how many people are familiar with this parking lot. Actually, a lot of Westsiders are. But there is quite a bit of room left there for the parking lot over to the right-hand side as they have set up tables to the left. So this is in the city. I also have talked to folks outside the city. Some are doing this and some are not. Some are doing the outside dining and some are not. You know, it's supposed to rain this weekend too, which I think is complicating things a little bit. I know some restaurants are putting up tents so they can accommodate diners outside. So I think it's a hit and miss. So the enforcement and the interpretations are left to the health department and to the local law enforcement, as you say. And so it's challenging countywide because there are so many jurisdictions with different police departments and enforcement authorities. But the health commissioner is the one, I like to say this about you, Greg, really the ultimate authority in trying to interpret what's happening and whether or not there's a violation there.
But I guess what I'm getting at, if people wanted to do, like you said, like what you showed there at Price in the county, if they wanted to set up tables in the parking lot, that permitting would have to go through the local jurisdiction, not the county. Is that correct? So I think if somebody, in some places, if you want to set a tent up, you do need a permit.
Yes, that it would be handled by the local jurisdictions.
Thank you.
Okay, our next question is from Scott Wortman for you, Greg.
Morning. And you kind of touched on this in one of the questions that Jay asked, but I just wanted to get an update because you didn't have many complaints on Tuesday when retail opened up. Was that pretty much the case Wednesday, Thursday too? You only got like a dozen or so complaints, or did it pick up, go down, or what'd you see?
I don't have an exact number, but I do know my team by Wednesday and Thursday felt slightly busier. I know if I had to guess, we were under 40 complaints each day so far.
Is that what you expected, or you had no idea what to expect, or?
Oh, I shared at one of these briefings when we first opened up, or when we first started the stay-at-home order. My team was probably receiving upwards of 200 complaints per day. So I was kind of fearful that we would see that level. Obviously, as I've shared, we've put in place the necessary things that can handle that, but I'd prefer not to get to that level again. I mean, it is definitely stressful for your team as you're managing that caseload. I really have to thank all of our jurisdictions. They have done just a marvelous job of getting the businesses within the jurisdiction to comply, and we continue to work and rely heavily on those political subdivisions.
One other question, just from a health standpoint, because you talked about the permitting for tents, things like that. In terms of outdoor dining, does the tent change anything, like health-wise, like having it under a tent, or is there any health considerations regarding that?
No, I don't believe so. You know, the requirements for restaurants include cleaning seats and tables between each guest. Obviously, the floors inside restaurants and the ground, even if we're opening up streets, those are dirty just generally. If food falls on the floor inside a restaurant, I wouldn't recommend eating it. Same thing now that we're in the outside environment. I think it's really important just that the restaurants take the necessary precautions.
But a tent is still considered outdoor seating. That doesn't change from a health department standpoint if it's under a tent.
I believe that's accurate, although I'd have to have the order and carefully comb through it to make sure that was a true statement.
Okay, so that's not known whether that violates the order or not?
I would have to read the order to look and see if it is mentioned specifically inside the order.
Okay. Thank you.
Okay, that appears that concludes our questions from reporters.
So what I heard you say, Greg, is that the 5-second rule does not apply. Any parent out there knows that we have a 5-second rule. If it hits the ground, it's 5. Pick it up. Okay, so that's not true. I'm just kidding. So it's fair to note that there are things that we just need to be really careful about that maybe we have not been as careful about in the past. So, all right. So we're launching into kind of a new reality here. Remind us, so we've been talking about restaurants and outdoor dining because that's the only thing allowed right now. Remind us the date for when indoor dining is allowed.
Next Thursday.
All right, so next Thursday. So we've got this weird little pocket of time where restaurants are trying to adapt to what's allowed right now with the outdoor dining. But by Thursday, indoor dining is going to be allowed. And that's a whole nother bowl of wax. Maybe we'll have you on next Friday again to talk about how restaurants are complying with the distancing rules, with the masking rules. Employees have to wear masks. So more to come on all this as we roll out. And I have anecdotally been talking to a lot of business owners to try to figure out how they are adapting to this. Not only restaurants, but everybody. But restaurants are kind of top of mind. And so we'll continue to do some anecdotal research and research otherwise to figure all this stuff out. So on Monday, Tim McCartney, who is the director over at Jobs and Family Services, will be with us. As we have talked about before, there is a great deal of concern about kids right now. The numbers of reports for child abuse have gone down. And so you would think that that's good news. But what we think we know is that the neglect and abuse has not subsided, but the reports have subsided because the kids are not interacting with people at schools, teachers, counselors, adults that they come into contact on a daily basis. And there's a great deal of concern about the safety of kids right now. Also related to some stressors and mental health issues that are happening perhaps in the home. And so Tim is going to talk through this with us. I know there was a statewide call, I believe it was yesterday, kind of comparing notes on what folks are seeing throughout Ohio. And so we've asked him to come in and talk to us about this as daycares start to open, as rec centers and pools and all the rest of it start to open. What do we think we're going to see, and what's the response to this? It's very concerning. I don't mean to, this has been very informative today, but we've got some real concerns about some other issues happening in Hamilton County. So Tim's going to be in on Monday to talk us through that. So Bridget, if there's nothing else, thank you all for joining. Have a great weekend, and we'll be back on Monday. Thank you.